Hello, my name is Jankowski. I'm a physical therapist with 40 years of experience. I specialize in neurological rehabilitation. 28 years ago, I promised my mother that I will break down spasticity or find cure for it. I did not care how long I have to work. I didn't care how hard I have to work. I decided I'm going to do it. First of all, I'm glad I didn't know how long it takes and how hard the work is, but it can be done. In order to break down spasticity, we have to use Botox injections into the spastic muscles. Botox has been used in neurological rehabilitation to manage spasticity, but I was not interested in managing spasticity. I was interested in curing spasticity or breaking it down. In order to break down spasticity, I developed a new approach to neurological rehabilitation, and this treatment works. We have to change our approach to how we inject Botox into spastic muscles and how much Botox we use. I will gradually post new videos on YouTube and I will explain how I did it and how the process takes place. Today, I will make comments about a few of my patients who recovered from spasticity after suffering strokes. And I posted them on YouTube under Jankowski method strokes. I have developed a new treatment for ataxia, which is very effective. You can look at my patients' videos and their recovery on YouTube under Jankowski method ataxia. I have discovered the cause of idiopathic toe walking and developed treatment which cures toe walking permanently. The lecture on toe walking is available on my website, Neurorehab.center. Log in, purchase the lecture, and you will know everything about rehabilitating toe walking. I'm currently working on testing my approach with Parkinson patients, and so far the results have been phenomenal. The mask-like face disappears, gait pattern goes back to normal, range of motion goes back to normal, and one of my patients, I have two. The first one, we were able to get rid of the tremors in the hands. So with Botox treatment. So the other patients I'm working with has made phenomenal improvement. Mask-like face gone, normal gait pattern, and now he's scheduled for Botox in 2 weeks. So after the Botox, we will continue working. And if I get the same results, then we know we have the treatment for Parkinson's disease. There is more hope for Parkinson patients. Now, let's talk about a few of my stroke patients that I posted on YouTube. So I will make comments for you, tell them what happened and how the recovery was. You will see it and how long it took and what we did. So here is one of my patients who suffered a stroke, affected his left upper extremity, some weakness in left lower extremity, no problem. The left upper extremity, he has spasticity level, and mainly fingers flexors, that's about 2+ on Ashworth scale. And what we did, we injected, about 3 months into rehab, we injected 300 units into fingers flexors. And I'm asking him here to throw a ball with the left hand. Of course, he cannot do it. So what we have here is a weakness. There is some hypotonicity in the upper arm, so above the elbow joint, and there is some 2+ spasticity in the fingers flexors. So I'm asking him to move his arm up. You can see it. Not much is happening. He's got movement, motor control, so movement in his fingers preserved. And after 5 months of rehab, he had a Kaiser insurance. Of course, we didn't take Kaiser insurance, but he was a father-in-law of my friend therapist. So I said, you know what? I'm going to do it pro bono, and I asked him to work with me 6 days a week. We did it 6 days a week because I wanted to see how fast I can have him recover from his stroke. He's doing fantastic, normal strength, spasticity eliminated, and he is doing very well after 5 months of rehab. But he worked very hard, very hard. I worked with him for about an hour, a little over an hour on the upper extremity, doing other exercises, breaking down spasticity, and he worked extra hour in the office just performing the exercises that I recommended. Beautiful recovery. As long as you work hard, you're dedicated to your recovery, sky is the limit. You can see that. Let's go to a next patient of mine. My next patient, he suffered a stroke which affected his left upper extremity. He had some difficulties with balance because of weakness in his trunk and left lower extremity. He was ambulating with cane. It took me 14 months, and we used about 1,600 units of Botox, 16 vials, to break down the spasticity in his left upper extremity, which was about 4 minus 4. You really can't be really precise. You can try to be precise in describing the level of spasticity, but it's hard to be really perfect because the spasticity, it may look like it's 4 on Ashworth scale, but it will break down really easy. And some patients will have 4 on Ashworth scale, and it's very hard. It all depends on the density of the spasticity. So let's take a look at his progress. So I'm asking him to move his arm. See, he's got the flexor pattern. Open mouth, we call that fly mouth. But again, he worked very hard, motivated, and worked and did always extra. 3 to 4 times a week. I worked with him for about an hour and 15 minutes, an hour and a half. This is 9 months. And he worked extra half an hour performing the exercises. Normal recovery, no deficits. Look, this is what happens if you break down spasticity and if you have underlying motor function, motor control, so movement, then the game is over. It's only time, hard work, Botox injections, and consistency with therapy. Beautiful recovery. We went fishing to Alaska. There's no sign of a stroke. Everything returned to normal. Let's go and see another patient. The next patient, it was my first stroke patient where I recovered the arm. He had a spasticity level in left lower extremity, about 3 hamstrings and calf muscles, tibialis anterior a little bit, but mainly hamstrings muscles, about 3 on Ashworth scale, and 2 plus in left calf muscle. He had, it looked like mild spasticity in his left upper extremity, but actually it was only hypertonia. When I came to see him for the first time, he was ambulating with hemi walker. He was not able to ambulate up and down stairs. He was scooting up the stairs on his buttocks. And the left upper extremity, 0 motor function. There was nothing in left upper extremity. I got him about a month after his stroke. I saw him in home care when I was working in home care, and then he encouraged me to open up that Neurorehab.center or Stroke Rehab Center. Actually, when he recovered, he was helping me with patients, giving them motivational speech. Again, he worked extremely hard. 3 times a week for 1 hour, I was working on his arm. We were performing about 500 to 600 repetitions on the left upper extremity, plus I worked on his leg. Once we opened up my office, he continued rehab. We did Botox injections to his left hamstrings muscles. I think we did maybe 100 units in his palmaris longus muscle. The rest of it was just working and recovering fine motor coordination. It took me 1 year, and when I discharged him from physical therapy, I asked him to work on fine motor coordination because he's left-handed and he had a hard time using a drill or screwdrivers because of the deficits in fine motor coordination. And it took him another year to fully regain fine motor coordination, strength to 4/5, and he's doing beautifully. And it was severe stroke. It was an internal capsule. So if you're a neurologist or a doctor, a physiatrist, you understand this is where the corticospinal tract and reticulospinal tract are going down, and people do not recover. He also had 3 small strokes in his pons area. The gigantic white spot right here, that's internal capsule. Nobody recovers from this stroke like he did because current methods of rehabilitation will not get you to this point. This treatment, this recovery requires new approach, and that's called Jankowski method. What was interesting, he asked me to videotape him when we were doing the rehab before he started making progress. I kind of neglected that, and I regret. But you can imagine zero motor control, flaccidity in left upper extremity. And what's interesting is now the question is if it makes a difference if we start the intensive therapy right after stroke versus if we wait. So I assume that there wasn't much spasticity. There may be some hypertonia, a little bit of spastic tone in his fingers, palmaris longus, if I remember correctly. And look at him now, full recovery. This is not magic. This is just a new treatment. Look at him. He still has a little limp. I was very happy. I mean, I could still work and correct the remaining deficits. But he said, I'm fine. I'm thankful that I recovered so much. So this is how it works. Let's take a look at another patient of mine. So the next patient suffered severe stroke, spent months in the hospital. When he came home, I saw him when I was still working at home care. And then about 2 months later, I opened up my clinic, Stroke Rehab Center, Neurorehab.center, and we continue rehabilitation in our clinic. When I evaluated him, he had co-contractures in his fingers flexors extensors. Spasticity level was 4 in around the shoulder girdle muscles, very tight, very painful, and 3 plus in his bicep fingers flexors, and he had about spasticity level 2 in his fingers extensors. I'm asking him to make a fist and move his arm. You can see he cannot make a fist because of the co-contracture. And he had spasticity level 3 plus in the left hamstrings and about -3, 2 plus in his calf muscles and tibialis anterior muscles, those extensors. And it was 2 years of rehab. And look at him. This is his initial evaluation. Yeah. Shoulder is stuck in this position. He cannot move. It was very painful for him, but we used Botox and we broke down the spasticity in the entire shoulder, pectoral muscles, upper trap, periscapular muscles, and his shoulder stride with the left lower extremity due to spasticity. Every patient who has underlying motor function, if you have any movement in your fingers up and down, like in the case of constraint-induced movement therapy, movement at least 10 degrees, fingers flexion extension, you are recovering motor control. It means motor control is preserved. All you have is just overlapping spasticity in the affected muscles. And once you remove the spasticity, gradually strength comes back, range of motion comes back, sensation come back, proprioception comes back to normal. And you will see him on the progress video 2 years later. I still could make him even better. But he said, I'm happy the way I am. We don't have to do anything. He's doing fine. Look, arm came back to a normal life. We went fishing to Alaska, had a good time.